Jerry, tonight is for a real treat. I'm personally going to pay the dinner for you and Audrey.
Problems here, right? That's a famous episode of Seinfeld where the chef comes out of the bathroom, makes several mistakes, touches his hair, zips up his pants, all of those things without washing their hands. Dr. David Gerson in with us this morning. We've all heard that hand washing several times a day can help avoid you getting sick during cold and flu season, which is quickly approaching. So Dr. Gerson with Baptist Health has some tips for us. It sounds so simple. You hope everybody's doing it. We know they're not because we may have seen that same sort of scenario ourselves.
I was just thinking we should post, instead of hand washing instructions, we should post "Don't be a poppy" in the bathroom. I think it'd be pretty funny.
Exactly.
I am here to solve the great debate, debate of, you know, the hand sanitizers and the hand washing with good old-fashioned soap and water. And soap and water wins every time. The sanitizer is convenient if you don't have a sink around, but you are not killing everything. And with soap and water, you're actually moving those germs off the hands. And so that's important. If you get a chance to soap and water, as far as temperature, hot water is best if you got greasy hands, but it really doesn't matter, so just try to hit the soap and water.
And it takes more than just running your hands very quickly underneath the water and drying them off.
So, you know, one is timing. So there's little instructions here. You know, wet your hands down, put the soap on the hands, and then we really want to get to all the surfaces of the hands, even down to the wrists. And you want to go ahead and wash and lather up for about 20 seconds. So some of the tips we give is, you know, sing happy birthday to yourself a couple times. I know a few doctors that do the Lord's Prayer. That kind of just gives you enough time to get all those nooks and crannies. And then, of course, rinse off. And then, very important, towel off, and use that paper towel to turn off the sink and also to open the door to leave.
Because if you don't, you're just infecting your hands with germs.
I'm laughing so much because I can't tell you how I've done that same look that Jerry Seinfeld's done. So many times I've been in a public bathroom and people walk out and you're like, what are you doing?
Right.
You know, so yeah, anytime you're going to touch a surface that could potentially have something on there, you wash your hands. I mean, I probably wash my hands on the average about 80 times a day, but I'm seeing patients all day.
Sure.
And so if you're doing anything from taking out the garbage to preparing foods to, you know, helping your child get dressed, any of these things, anything you touch someone else or some other thing, wash your hands.
You can't do it too often, and that's something we can remind our children of. It's hard for them to want to go wash their hands, so we have to push them in that direction.
Absolutely, absolutely. And also, we'll just add to that, try to find as far as what kind of soap, they're all pretty much equally efficacious. Do find something with a moisturizer in it if you're doing it as often as someone like me.
Right.
You know, if you're doing 10, 15, 20 times a day, you need a little moisturizer in that soap as well.
So your hands don't get too dry. You mentioned hand sanitizers there. That's the alternative. If you're in the car, you're someplace where you can't get to, then that's going to help.
You know, so you talk about, well, they're 99.99% effective, but you have thousands upon thousands of microbes on your hands, so you're still leaving some behind. There was that debate in hospitals and academic areas, you know, where they have all these little hand sanitizers. Yes, they're good, but they're not optimum.
Okay, so if you can get to water and soap, that's going to be your best bet. And really, you see it. It's preventing diseases. If you think about a stomach bug or the cold or flu, it doesn't take long to try to prevent that.
We all, by nature, constantly touch our eyes and our nose. It's just what we do, you know, for a sniffle or an itch or something. Those are the portals for infection, and that's on your hands. So get the bugs off.
Wash them often. Dr. David Gerson with Baptist Health. If you have a question, you can always call the Baptist Health Helpline at 1-888-BAPTIST. We'll come